been purely supportive of the Orthodox point of view is rather remarkable. The fact that you're here shows you had to have courage to stand up for yourself at some point. Because a few years ago, you'd been considered a crazy person for wanting to try to get healthy. Well, you are healthy. You don't have any disease, do you? Well, doctor, what you're telling me is that I don't have a disease if you can't find one that's classically symptomatic. But think of it another way. The same logic would be, I'm either a millionaire or I'm a pauper. My gas tank is either completely full or totally empty. You're not acknowledging process. That my arteries could be 80% occluded before the first symptom occurs. And the first symptom could be a heart attack. So the day before my heart attack, you say, you got a clean bill of health. And the day after my heart attack, you've got congestive heart failure. The day before, 30 years of processing a cancer by eating and smoking and drinking and the things you say are okay in moderation, you'll say, I have no problem. And the day after the tumor appears, we got it early. No, it's 20 years late. So I'm suggesting that I am no longer any interested in working with that system because it has shown it does not want to work with me or people who believe as I do, that we should have an open mind and care about people instead about the power, the authority, the prestige, the money that comes with controlling a paradigm. There is no humility in medicine. I mean none. Do not let someone tell you that they're interested in helping the benefit of the people, in which case then say, doctor, get into a clinic 3 days a week and work for free and help the poor. Now, when I see that, I'll say, good for you. But I see all those big homes out there with all those fancy cars, and I see big bills, and I see people being paid even when they kill you. Unique profession. You win if you lose, and you win if you win. Something's wrong with that. So that's why I created this program. So this program is no longer going to butt heads with them. No longer going to challenge. Whatever they can do to help people, I support it. And I'm not supporting alternative medicine either, because alternative medicine is merely orthodox medicine with this little subhead to it. Chelation, or ozone, or bioxidation, or homeopathy. But it still doesn't take into account the whole dynamic of the individual, working in relationship to their mind, spirit, body. When was the last time you sat down with a physician, a holistic physician, who gave you an hour and asked you to talk about your spirituality? Ask you to talk about, are you honoring your life? And you don't think that's a part of health? It is. I'm looking at a whole new model, and it's a wellness model. Now, the wellness model works differently. It works on elimination, detoxification, rebuilding, and then exercise, stress management, a diet for a lifetime, and self-actualization, changing the things that do not work in our life, challenging our belief systems. You might call it 7 steps to total health. Now, each one of those steps has many different parts to it, as we will see when we start to explore it. The majority of the effort is not on diet. Diet's actually the easiest part of this whole program. Exercise is relatively easy. It's just the consistency, meaning when you start making a good choice, don't go back and make a bad choice. Keep making a good choice. But to keep the easy things steady and focused, you got to work on the hard thing. And the hard thing is the beliefs. It's the belief system that ends up causing you the problems. You never started and stopped a diet because you want to get healthier. You started a diet because you want to get healthier, and you stopped it because you couldn't consistently be kind to yourself. You couldn't continue to make the right choices. So we want to continue to make those right choices. Otherwise, everybody can go on a diet, lose weight. They go back to the old way. Everybody can start something, stop something. Think how many times in life you started projects and stopped the projects, right? Well, that's because you're working on the wrong end of the importance scale. You're working on counting the calories instead of who are you as a human being. If you worked on who am I as a human being, then counting the calories would not have been an issue. You wouldn't have had to count calories. So what we haven't done is, and what this program intends to do, is get you focused on what really is important. Now, because it's a wellness program, there's no discussion of disease. We're not giving a protocol to help any disease. But we've already done this 5 times over the last 7 years with large groups, 700 people, 1,000 people. And I see what happens when people stick with the protocol. Major changes. Well, if you can help all kinds of conditions in all areas, then it shows you what we've been missing in the American psyche is a whole sense of preventativeness. You know, taking responsibility to prevent something before it happens. It's like we want to put people in a Maserati and never give them a driver or a safety lesson and hope they don't wreck. Well, when we don't practice prevention in lifestyle, behavior, diet, and exercise, then what in the world can reasonably be the outcome except we're going to get sick? And then either we justify our sickness, make excuses for our sickness, or we adapt to it, in which case nothing ever gets better. You're never going to feel better, never going to look better, never going to look younger. Or you decide, this isn't working, let's do something that will really make a difference, and you start to change. Now, the hardest part of this program is in the initial few steps, because that's when most people are up against all those old voices saying, eat the hamburger. Bury your face in those French fries, right? Have the cigarette. Start to gossip again. You know, listen to the negative news. See who's been burned to death or shot, or you need that, right? Yeah, no, you don't need that. And you don't need the French fries, you don't need the hamburger. But once, and until you're really confident of who you're doing this for, at any given moment, you can take the exit and go right back to where you were. But you've been there, you've done that. You've taken too many exits in your life, never got to where you're going. And when you did, you didn't even know why you got there. How many times have you worked so hard to get a goal, and you get the goal, then you wake up and say, I thought I was supposed to feel better having all this work and getting this goal. I don't feel any better having achieved this. Now I got to do something else. Perpetual goals. Well, it's because the wrong person was taking the journey to the goal. So we want to stop that and say, what do we have to do to get in touch with the real self? So that's what this program is about. It's about resolving conflict, preventing the wrong choices from being made in the first place, and living a happy, healthy, balanced life. Otherwise, it's going to be chronic turmoil. And disease is merely an extension. It is a symptom of a body and mind and spirit that are not balanced. Now, when we learn how to cleanse the system, which we've been doing with the juices, the green juices, and we know that the chlorophyll is the great blood cleanser, and we know the phytochemicals, the plant chemicals from the vegetable family and the fruit family will not only help prevent viruses and bacteria and yeast and molds from manifesting in our system and doing the damage, but we also know that many of the phytochemicals are specific to help the cells. Now, they help the DNA of the cell. What that means is they can actually take a cell that has been damaged, and some of your specialized cells, once you've damaged it, they stay damaged forever, and it becomes your weak link. And that weak link is ultimately what brings you down. So let's say you say, well, Gary, why did I get lung cancer? I stopped smoking 10 years ago, 20 years ago. Yes, good. But the damage that was done 10 and 20 years ago is still there. It's the weak link. Now, granted, a good diet can slow down additional disease process. Stress management can slow down disease. Exercise can slow down disease. Cleaning up your home and work environment can slow down disease, but it cannot reverse it. Not your major disease, not those that are done on the cellular level. Now, that requires something additional. I mean, could you imagine going over to, a car that you ran against a wall at 80 miles an hour with a tiny little hammer and trying to knock out all the dents? You can't do it. What you got to do is you got to apply, you got to prevent, 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 you got to pr a level, therapeutic level, that is different than the preventative level.